main needs that I see at Central High School each day is really, for a lot of students, it's their basic needs, their basic skills to survive, their food, clothing, housing, all those issues impact the children.
I'm Connie Gino. I'm the community health worker here at Bay City Central High School. I have been at Bay City Central for approximately 3 years. A community health worker is a person who can connect people with resources that they may need and to help them find out truly what they need. They might not even realize that they need a service.
The community health workers changed tremendously our support for our students. Our counselors and our nurses have been wonderful, but the counselors are really, they have 340 something students on their caseload that dealing with scheduling. The community health worker has been able to actually meet with these parents, meet with these students, and get them right to the agencies that'll help them out right away and not have to wait a week or two. It's immediate feedback for these parents. So it has been unbelievably beneficial for my students, for my families. And we see a difference with some of the students as they're coming to school, knowing that they have someone to go to and that someone's actually going to help them out.
I came to Great Lakes Bay Health Centers in 2014. I was in the homeless shelter, and I realized that the shelter was not for me. It's a place for different kinds of people, but I wasn't one of them. After I left the shelter, I lived in my car for 3.5 years. I hadn't been to a dentist in over 5 years. And my fillings, my teeth, they were really bad. So when I first came to Bayside, they told me that I needed a lot of work done. I quickly got all that work done. And it was good for me to get it done, and it was good for them because they filled up that cancellation. So it was win-win for everybody, I think especially for me. I've had a lot of fillings. Of course, you get your teeth cleaned twice a year. I had a tooth pulled, and I've had crowns put on. And I'm almost sad to say it, but since 2014, not counting this year, I've been to the dentist here 50 times. And the only thing I ever had to pay for was crowns, and part of that was paid for. But you think, well, 50 times seems a lot, but they were happy to have me, and I was happy to be here. Before, you look at your smile, and you don't want to smile. Now I look in the mirror, and I look at my teeth, and I go, hey, this looks really good. You know that your physical needs have been taken care of. Yeah, you're not young anymore. You can't do the things you used to do, but you're taking care of all the things that need to be taken care of because of this place. If they hadn't shown the care that they did, I would have been hard pressed to do this by myself. When I come in, it's not like I'm going to a doctor, it's like I'm seeing a friend. That's how I feel, and they're happy to see me as well. It makes it feel like they are anyway.
Well, I had been doing drugs for more than 10 years. I broke my wrist, and then as soon as they gave me Vicodin for it, it was over. Never done anything your whole life, and all of a sudden you get a prescription for Vicodin. I feel like that is the worst drug that's ever been made. It's so addicting. The first pill I took, I knew it was over. I knew I was gonna use it, but I was also a very functioning addict. And that's what it was. I worked a full-time job. I was making good money, so I could afford my drugs. I couldn't afford anything else. I mean, my bills were barely getting paid. It was bad. It was real bad. So what brought me into Great Lakes Bay is I just got up. It was a Thursday morning, and I was just tired of being sick and tired. I was just tired of the chase and the everything. So I Googled nearest rehab center, and 1016 came up. Walking through that door Friday morning, whew, tough. That was one of the toughest walks I've ever had to take in my life. And thank God Greg was here. He immediately stopped what he was doing and sat down on the couch and talked with me, and we cried. He was a lifesaver. I wouldn't be here without him. When they brought me in, they had Paul bring me into this room. We had a conversation about what would it entail, what the program looks like. Was I willing to commit? And then I had to go into physical withdrawals. I had to be in moderate withdrawals to be able to take my first dose of Suboxone. So they scheduled me to come in the following Monday. I went home and I withdrawed. It was Mother's Day weekend. It was hard. It was so hard. It was a whirlwind when I got here on that Monday morning. I walked in the door and it was all kind of a blur. They took me in and immediately gave me like a rating, rated how far into withdrawals I was based on my symptoms. To be able to take something and be able to go the whole day and not feel those withdrawal symptoms, it was so freeing. The first week of Suboxone, it was pure joy. I was on the program for about 15 months. And then at the 15th month, I decided to wean down. And so I got completely off. Being an addict is not fun. Nobody wakes up in the morning and chooses to be an addict. So when I think about everybody out there who's still using, there is a better way. There's just a better way. You don't have to live like that. And thank goodness for 1016, because without them, I know I wouldn't have made it. I would not have made it.
I started working as a nurse in 2017. I just have a caring heart for everybody, and I like to take care and be a helpful person. Pediatrics and women's care was always my passion when I went into nursing. What I love the most about working here at Great Lakes Bay Health Center is we empower women. We get to watch them flourish from their very first appointment all the way to their last, and we get to see the reward of the babies at the end of it. I started working here in June and then had a positive pregnancy test in the first part right before COVID in February of 2020. I wasn't going to receive care here because I was new and I wasn't sure, how I felt about getting care where I worked. So I continued and got care through the previous physician that I had seen. She started out by doing lab work. It quickly turned into she didn't believe that my pregnancy was continuing and believed I was having what's called an ectopic pregnancy, which is a pregnancy in the tubes versus the uterus. At that point I thought, I wasn't pregnant or I was gonna have to have miscarriage. I was devastated. I mean, yes, it happened quickly, but this is something we both wanted and we were really excited. And it's always devastating to hear that, you're not pregnant or you're gonna have a miscarriage or something's wrong. But when I went to the other doctor's office, she kind of instilled fear a little bit. So I in turn came here and I talked with a couple of the physicians and they said, definitely you should wait. And that's when I felt the most safe, was when I talked with our doctors here, because they look at the whole picture versus just the lab work. They look at ultrasounds and the way the mom is feeling and all those things before making such a big decision. Once I came over here and everything was okay, they kept doing weekly ultrasounds just to see if things were forming. And then when I first seen that baby's heartbeat, I just cried. And everybody here was so excited because it was obviously they went on this journey with me. I mean, it was great. I could still cry about it today. I was exactly 35 weeks. I did have to have some postpartum support. Obviously, he was in the NICU, which was very traumatizing. Postpartum depression is very real. I needed the care and I finally reached out to, it was Dr. McKee at the time. And she's like, we're gonna get you on something. We're gonna make you feel better. I truly believe that my son wouldn't be here if it wasn't for Great Lakes Bay Health Centers.